forgot to Hi, good evening, everyone. So this is one of the nursing webinars that we are conducting. Most are for doctors, but this is more for nurses. It is a very with great pleasure, I welcome Suyin. Suyin was my classmate from in secondary school. We did Form 5 and Form 4 and Form 5 in the same class. So then we did Form 6 together. And then Suyin went to do nursing in the UK. Then, of course, married a British guy. And then now she's residing in Canada. So she's actually giving this lecture from Canada. What time is it there in Canada now?
8 o'clock in the morning.
8 o'clock in the morning. So thank you for coming out so early. And Suyin's career has kind of took a turn actually to something she really loves to do, which is actually from midwifery, right? Oh, yeah, tell us about yourself.
Yeah, so when I left Malaysia in 1983. Maybe some of you are so young that you weren't even born you weren't even born in, not 1983. I left in 1989. I was 23. So I went to England, to Bristol, and we've just been chatting about Bristol to Betty because one of her children is living there. And I did my nurse training there. And then after that, I worked as a staff nurse for a year in a trauma and orthopedic ward. And then I moved on to become a midwife. And so I trained to be a midwife, and then I worked in England for about 6 years as a midwife, and then I had my children, and then I gave midwifery up and went back to nursing. And when I left England in 2009, I was a nurse practitioner when I left, and a nurse, non-medical prescriber. So basically as a nurse, I was able to prescribe medications. And I left because my husband was offered a job in Trinidad and Tobago. So we went for what we thought was 2 years. My kids were 9 and 11. We thought that's not too crucial a time to take them out of education in the UK. But little did we know that after a year in Trinidad and Tobago, we were told that, we were given the opportunity to move to Canada. So Canada wasn't on our radar at all, but we just thought, okay, well, let's go. If we don't go, you'll never know. If you don't try things, then you'll never know. And later on, you're going to think, oh, I didn't go. Do I regret not going to Trinidad and Tobago? Do I not? Whatever. So anyway, so I've been in Canada now from 2010. So that's like 13 and a half years. And when I got here, the Canadian is not so much so now because of the pandemic. But when we first arrived, and it continues to be a little, the Canadian professionals are very protective of their own local professionals. So professionals that studied here, trained here, got their license here. The government and the College of Nurses, doctors, whatever, even engineers, the School of Engineering, everybody, all the professional associations, they're very protective of their own professionals. So when you come, even if you're a civil engineer, you're a nurse, you're a doctor, whatever, they're going to require quite a lot from you. So if you guys are thinking of emigrating to Canada, think really hard, because they will accept you on your PR application and fast track you and everything. And then when you come here, you discover that you actually can't work straight away. And there are a lot of doctors, just like in London and in the UK, who are doctors who have come, unable to do the professional exams, unable to pass, cannot find the time to study, don't have the money to study, and they end up being taxi drivers, Uber drivers, or they become, ultrasonographers. They just do something that is, not what they've been trained to do and what they've, gained their education to do. Okay, so this is the same, I think, for almost any kind of like, G8 country you want to emigrate to. They will be somewhat protective of their own professionals unless they are desperately in need of you. So right now we have a major shortage of nurses. So maybe if you want to come in, they will fast track you in some way, help you sit your NCLEX exam or the Board of Entrance exam, and you can get there. For me, it wasn't so easy in 2010. And I waited for 3 years for them to approve my training and everything else. And then they said to me, whatever, you have to do all this stuff. And I was like, okay, I don't really want to do all this stuff. I'm too old. I was 44 and I just thought by the time I finish, I'll be nearly 50 and you'll give me all the work that I don't want to do because I have no Canadian experience. So you're going to give me all the shifts that nobody wants. So that's why I moved. I kind of like, pivoted and thought, what else can I do? Because as nurses, you all have a lot of transferable skills. You have great communication skills, you have clinical skills, you can meet anyone and you can talk to them straight away and make them feel comfortable with you, because that's what you need to do when you're a nurse. You need to make your patients feel, comfortable and respect you, and not only that, and be comfortable and have confidence in you to be able to give them the care that they need, right? So I thought, what can I do with all of this? And so then I was, somebody mentioned the word doula to me. So I researched the word. I'll share my screen now, then you guys can have a look at the presentation. So this is this. Can you all see my screen clearly?
Yeah.
Yeah. So this is who I am. So this is what I did. So went to Bristol and did my nursing. And then I went and then I became a registered midwife in the University of West of England. That's also in Bristol. And then so after that, I decided, okay, I researched the word doula. I found out what it was. And I thought, oh yeah, this is something I could do. And also a neighbor downstairs, we were living in an apartment at the time, was having twins, and she had no family around her and no one to help her. And she also had a 7-year-old daughter. So she was actually kind of like my first doula client without me knowing. I just went to help her because I wasn't working at the time. So these are all the things that I did with CAPA. So I trained with CAPA, and CAPA is the Childbirth and Pregnancy Professional Association. They are a worldwide association, but the headquarters are in Atlanta, USA. They have a branch in India. They have a branch in Central America.
Yeah, I think I want to go and speak to them and bring this program here. But never mind, go ahead.
Yeah. Okay. So CAPA is I love CAPA and I joined CAPA. I love their vision and I love their principles, and the doula profession is not regulated, okay? All over the world, it's not regulated. So you don't need a license to be a doula. Anybody can call themselves a doula. You don't even have to do a training to become a doula. You just have to know how to look after people and look after babies and be happy with that. But that doesn't make you a professional doula. That just makes you a doula. So we have a lot of these doulas already existing in Malaysia,
Okay,
especially.
Can you define the word doula? Because before you became a doula, I never knew the word doula.
Okay, yeah, I'm coming to that.
Okay. Oh, okay.
Okay, let me just carry on with all of this.
Okay.
So CAPA is a huge umbrella. So they have a lot of other courses that are inbuilt into their association, so that you will just pay one membership fee for a professional association and you're covered for everything. So I became a certified childbirth educator. I became a certified new parent educator. I also did lactation education, and I also did labor doula. I didn't certify in those because I was already a midwife and I just didn't feel like I needed to certify to be a labor doula. And also I wasn't really interested in so much in doing labor work, birth doula. I mean, I know some people really love attending births and really love watching the baby being born and supporting people, and I let them do that work. My interest is more in the postpartum period, because I feel that, the pregnant person is revered until they give birth, and then everybody disappears after that. Everybody comes to see the baby. Nobody cares, like, what's happening to the mother's recovery. Not really. When you think about, preparing for birth, everything's like, lots of childbirth education. Yeah, look after the mother, eat well, do all this kind of stuff. The baby is born, and then suddenly no one's looking after the mother. Prenatally or antenatally, how many appointments you have with your OB? Quite a lot, right? 6 or 7. Then you have your baby. When's the next appointment you have with your OB or your gynecologist or your nurse? Unless you have a midwife, that's a little bit different. But, if you have an OB, and I think most of the people in Malaysia have OBs, you will probably have one postpartum or postnatal appointment with your OB at 6 weeks postpartum, when your postnatal period is supposed to be finished, right? So nobody cares, and there's a lot of complications that can go on in those 6 weeks, but nobody's looking out for the mother. So that's why I'm so passionate about this work, because supporting parents in that period is so important. And like recognizing the red flags and like signposting clients at that point when they're, they may be in danger or their health may be in danger is kind of like, very kind of like job satisfying for me as well. And seeing them bloom as parents instead of like being anxious about looking after their baby and just seeing them as confident parents is also another important point. So anyway, I became a sleep consultant and then I started my business. So I think Betty wants me to touch a little bit about business. So in Canada, the doula, it's all private. But some insurance companies here, so third-party medical insurance companies now, and a lot of people here who have permanent jobs, full-time jobs, they do have a plan given by their work. So Sun Life and Manulife and some other insurers, there's also Carrot here now, are now offering to pay for doula services. If the family has a flexible health spending plan, doula services can be included, and their medical insurance, third-party medical insurance, will pay for our support. They will be granted an amount like $1,500 or $2,000 or whatever. But the caveat there is that you have to be a certified doula, postpartum doula or birth doula with a recognized association that trains doulas. So Kappa, DONA, which is a doula organization of North America, and the other one that's coming in for Canada is Doula Training Canada, another school. They recognize these three mainly, but so not but and so it's kind of like important if you want to have a career in becoming a doula, you choose the organization that will allow you to be recognized by insurance companies. So you don't waste your time having to recertify with somebody else. So I opened my own business in 2013, and then I incorporated my business. So I became a company in 2018-19. And then in 2021, in order to support more people, because I'm one person, I can support 1 or 2 clients at a time. Maybe that's a maximum of 20 to 24 clients a year. How can I support more women? Because I was getting quite a lot of requests. In fact, every week I get about 4 or 5 requests, which is not a lot. Some people get even more, but I got 4 or 5 requests a week and I couldn't fulfill them. So I thought, what can I do? I thought, okay, I'll train doulas. So then there'll be more doulas out there. So I became a doula faculty member at Kappa. And then it's still not enough. So in 2021, my friend and I, Petra Nobel and I, we decided to open another company called Thornhill Doulas, and has a partnership company. So she's my business partner, and we have an agency called Thornhill Doulas. So in that way, we brought in some independent contractors, and now we have about 15 or 16 of them, and we can serve 15 or 16 families at any one time because we have all these doulas working for us or with us. And the most recent thing that I've done, because I believe in lifelong learning, I never stop learning. So I am very interested and very passionate about breastfeeding and getting most parents who want to breastfeed, successful, because I really think that is like, the base, the perfect base that anybody can have. If you have been breastfed by your parents, you guys are, the smartest in the world. And I want that for all babies in the world. I know that's an impossible dream, but I am studying to be an international board certified lactation consultant. And part of that studying involved me becoming certified lactation support provider, which is what I'm doing now. I'm hoping to sit my certification exam and my board exam next spring, so April 2025. So right now I'm interning as a breastfeeding lactation consultant in a clinic, in a breastfeeding clinic, and then I also see my own patients and my own postpartum clients who are breastfeeding. Okay, so objectives of this talk: what is a doula? So we're going to go through that, the postpartum doula, and the scope of practice of a postpartum doula. So here we go, Betty, just for you. Doula. What does the word doula comes from the ancient Greek, meaning a woman who serves, or a woman slave. Are you?
Oh my God.
That's like my elevator talk. It doesn't get me a lot of business, but I used to say, oh yeah, I said I'm a doula, and they said, what is a doula? I said, oh, I'm a woman slave. But that gets the conversation going, right? They laugh, and I said, well, really, I serve women. I support them through childbirth and the postpartum period and beyond, right? So Today, the word doula refers to a professional trained to provide emotional, physical, and informational support to women throughout their pregnancy, birth, and early postpartum period. I don't know how inclusive you guys are. I might have to change this screen and use more inclusive language. So I think Malaysia is still a bit conservative. So you guys are not going to be too offended if I just say support women, because, you know, there are also others that don't consider themselves women. They're known by other terms, but in this talk, I'm just going to say woman because I think you guys are probably most familiar with that. So before, during, and after birth, doulas exist to help you be awesome at all of those things, like, you know, prenatally, in labor, and after. So this is not just something that I dreamt up or, you know, the Greek people dreamt up, but, you know, actually there is evidence for, you know, doula support. This is the evidence for doula support in labor. Okay, so decrease of use, 31% decrease of use in labor of Pitocin. So Pitocin or synthetic oxytocin to augment labor or to hurry up labor. There is if you have a doula supporting you, that's 31% decrease, you know, that they have found use of Pitocin. 28% decrease in the risk of cesarean section. 12% increase in vaginal birth. 14% decrease in the need for NICU or SCABU. And 9% decrease in the use of medications for pain relief, because you have somebody there supporting you and encouraging you and talking you through. Of course, if you went in there wanting an epidural, no one's going to stop you having that too. And 34% decrease in the risk of dissatisfaction. Okay,
so you are there with them during the birth?
Yes, we are there with them from virtually. So virtually, like through the phone, through early labor, unless they're not coping very well in early labor, we can go and support them.
I see.
But once they're in established labor, so once they get into hospital and they're like really laboring, yeah, we're there all the time. So the longest labor I think I've been with is like over 20. I can't remember, one client. Quite a long time, 24 hours or something. Yeah, so you're there like with them. Because you know when they're laboring, the nurse or the midwife is not in the room with them all the time, right? So yes, spend a lot of time laboring on your own, and like you're wondering what's happening and are things going well? And so having a supportive person in there telling you or reassuring you that everything is fine, you know, and just keeping you relaxed and keeping you good and happy helps you labor, right? Because if you're feeling anxious, your body will just, you know, if you go into fight or flight, and we all know when you're in fight or flight, you're not going to labor that well. You know, it's not a safe time for you to have a baby. So why would you have good contractions, right? But if you're relaxed and you're comfortable and you have somebody that you like, you know, you trust and, you know, you really click with, you know, really well, and, you know, is there supporting you, maybe doing a back massage when you have a contraction or anything, and also supporting your partner and your husband too. Because if your husband is anxious, that makes you anxious, and then the whole thing just stops, right?
I see. Okay.
Yeah. So a postpartum doula provides evidence-based information on things such as infant feeding, emotional and physical recovery from birth. Helps you with mother and baby bonding, infant soothing, and basic newborn care. Research shows that moms, dads, and babies have an easier time with this transition if a good support team is in place. So that's the evidence for postpartum doula. I'm going to show you a little video now just for fun. This one's about postpartum depression. And having a postpartum doula does decrease the
childbirth was this like weird dream. All I can compare it to is like an alien abduction. Little green crabby people kept coming in and sticking their claws into my hoo-ha every half an hour.
Yeah, and they don't mess around.
I hadn't slept in 40 hours. I was like trying to stay awake just so I didn't miss anything. You're like strapped to a table under bright lights. You get cut in half. Your organs are ripped out of you. And then all of a sudden they put this miniature you in your arms attached to your body. I'm just supposed to be like, oh, that was a hard day. I'm gonna move on now. No! That first 2 weeks of a baby's life, that's like waterboarding a mom.
Yeah, you're gonna isolate me. I'm gonna starve. If you have a toddler while you have a baby, you're gonna be endless interrogation. You call me a Navy SEAL after this training. Men have confessed to crimes they did not commit after being kept awake for 24 hours.
Yeah.
Put me in an interrogation room, man. I'll last 4.5 years. The physical pain, the lack of sleep.
It's like you're trying to do a nonstop, like 5-day CrossFit challenge, but your butt's been torn in half.
And you're so sad. No one talks about it, but like 90% of all women suffer from some sort of postpartum depression.
You're overwhelmed.
Everyone's like, this is the most joyful time of your life, and you're bawling so hard that you break a rib.
If I can't say this is hard, well, you.
I had terrible postpartum anxiety and OCD. I'm about to lose my mind, and I look in Expedia every day for flights.
Yeah. I'm doing great, you guys.
How are we supposed to not go a little cuckoo when you love this thing so much and the only thing you're thinking of is ways it can die? If it goes away, I will never, ever recover. I had this fear that if I picked up Finn and I walked into another room, I would hit his head on the door jamb and his head would explode.
I mean, we did that a lot actually because we had these French doors and they were just tough to navigate, especially when you're really tired.
I would cry all the time because I couldn't get control of it. You had postpartum.
During the day with the baby, I felt like I gotta be showtime. I gotta be like happy. Come on in. I'll make some coffee. I was just mixing up some homemade baby food.
Don't mind that my car keys are in the freezer.
I'm not wearing pants.
My
I'm not
bra's over the top of my shirt. Normal.
not a
I'm
real
fine.
details person these days.
Let me make a strudel.
But I felt like I had to be so happy because I'm like, I'm not gonna mess up this kid by being a normal person. But then at night I would be like, think of all the things I've done wrong. How is this gonna come back and haunt me? How come I didn't get that stockbroking job that I wasn't qualified for? I thought, well, if I had postpartum
How long is
depression,
this video?
then I'm gonna like Thelma and Louise. But the thing
Okay,
that
we
I
can
read was
stop.
that
It's
most
just
women are
5 minutes, but we can.
bad. They're like emotionally fatigued.
Okay, guys. So
So I don't
Yeah.
know whether she's
No.
drinking orange juice or orange juice with vodka.
who knows? Well, you didn't watch the end of the video. But anyway, that video is it's on YouTube. If you guys are interested, it's a couple of moms in the US and they're very hilarious and very truthful and very real. And their YouTube channel is called I Mom So Hard. I can write it in the chat for you.
Yeah. And the thing about us is that we take for granted that the support we used to get or we always get is
Yes,
from
because
our
like
extended family.
Yeah, Malaysia is different, right? Malaysia, a lot of people, if you
Right.
haven't moved away from your hometown, if you're still with your
Yes.
family, you would have your family around you. And
Same
also
here.
if you have moved, you have a confinement lady if you're Chinese. I can't remember what the Malay term for confinement lady is. Is it orang jaga? I don't know. I can't remember. If anyone can help me with
yeah,
that
yep.
and write it in the chat, that would be great.
Yeah, that's right.
So, you will have someone come and look after you. So it's different. In Asia, it's different, a little bit different. But then I think people are also maybe
But
moving
also, even
away
though
or
we
moving
have
away.
confinement lady, they are very traditional. They may not be educated in the sense that what is medically correct. They won't be
Correct. Yeah,
able
what is the evidence and care? You are absolutely correct. And that's the thing. Yes, the confinement lady will help you look after your baby and all that kind of stuff. And also like cook for you and make sure that you're looked after and some people, and then just be very strict with you. Cannot bathe with cold water. Has to be boiled water. Cannot drink anything cold. Cannot
bathe at
eat
all.
that.
Cannot bathe at all.
You didn't bathe at all. Right. That
I didn't have
exactly.
confinement, but yeah, cannot bathe at all. Some of
Cannot
them.
bathe at all, cannot, wash your hair, or if you want to wash your hair, like here, the Hong Kong confinement period here, because there's a lot of Hong Kong people living here as well, they will like use ginger peel because they've cooked the chikyok cho, they've cooked the pig trotters in vinegar, so they have a lot of ginger peel that they dry before. And then you boil the water, put all the ginger peel in there, and then you're supposed to wash and bathe with that water if you want to bathe. And then the water is like with the ginger peel, it looks like brown and looks so dirty and like most of my clients say, like, how am I supposed to bathe in this? I don't want to bathe in this. And I'm wasting my time boiling for them. But all those traditional confinement practices are because in years gone by, centuries ago, we did not have hot water from the tap. I think maybe some of you don't now in Malaysia, but for a country like Canada, we cannot not have hot water from a tap, or in UK, because we have terrible winters here, right? So we have hot water from a tap. The water is clean enough that you can drink it. We have, central heating. Our houses are warm. We have hair dryers. We have towels. So there's not going to be any bugs in the water that's going to disturb you in your postpartum period. And I'm sure that's where all our traditional confinement, practices come from. But Betty, you are right. A lot of these women, they have a lot of experience. They have a lot of experience looking after babies, but they have not moved on with the times, and they don't know the evidence, and they don't know the, what's safe for baby now. They will wrap baby up and all that. And that's actually, if the baby gets overheated, it's a risk for sudden infant death syndrome, right? So what are the benefits of having a postpartum doula? It allows the parents to rest and bond with their baby. We educate parents, and we help with all baby care needs. So when your confinement lady comes into your home, they take over everything. And that's not what postpartum doulas do. We do not take over, okay? We help you, we reassure you, we empower you, we instill confidence, we demonstrate care, and then we monitor you do care. We make sure that you're confident doing it. Because at the end of the month of having your confinement lady, and she leaves, your baby cries, you don't know what to do, because every time your baby cried in the previous month, she would pick the baby up and soothe the baby and help the baby be happy. The minute she leaves, you have this baby, and what do you do when they cry? What do you do if you've never ever changed a diaper or a nappy, right? So that's what a postpartum, where we're different. We kind of demonstrate care and, let them practice. And then, our job really is to make ourselves out of a job. So basically, that's when I leave, the parents are confident to look after their baby and confident to go on without me being there. Okay. So other benefits, help baby with baby nutrition. So we're we're experts in basic breastfeeding skills, or formula preparation and preparing formula safely. So the World Health Organization has a really good write-up on how to prepare formula safely. So whoever of you are pediatric nurses, I'm sure you know how to do it safely, but part of our job as a postpartum doula is to teach parents how to do this safely. But nowadays you can buy machines that can actually make the formula for you. You put the powder at the top, and then you put your bottle there, you choose how many ounces you want, and the machine actually dispenses and mixes and puts the amount of powder in, correct amount of water. But those machines are also machines, so they are not really that accurate, and there have been cases of babies being malnourished or constipated or all sorts of issues because of the machine not actually functioning well. So yeah, we talked about this, about how many times a woman gets seen when she's pregnant and how many times she gets seen postnatally, which is once. So like I said, a lot can happen in 6 weeks. Bleeding, infection, postpartum mood disorder, which is like postpartum depression, which is like the video I was just showing you. Problems with breastfeeding, so so that's where your work as a postpartum doula would come in. Okay, so doulas should have good knowledge about normal postpartum recovery. Therefore, we are at the forefront should anything abnormal occur. If we see any red flags, then it is our job to refer on. Okay. We're going to talk a little bit about scope of practice. So the doula profession, as I said earlier, is not regulated. Anyone can call themselves a doula. Okay, attending a training and attaining certification with your training organization is important so that you become a professional doula. Why is it important? So that we don't cause harm to others, and we also protect ourselves. So like if the client is saying to you to do something that's outside your scope, you can say, I'm so sorry, but that is not within my scope of practice. And that is to protect you as well as me, because I'm not trained and I'm not, that's not my work. So remember that doulas are not clinical, right? We don't take temperatures. We don't, assess whether a breast has mastitis or anything like that. Okay, all those are to be done by clinicians. So like by a nurse or by a doctor. If you suspect that your client has a problem, has a fever, you need to be referring on and advising them to see the doctor. You are not taking somebody's temperature and listening to the heart. You're not doing any of that because you are not a nurse. I know you guys are nurses, but when you are a doula and you're working as a doula, you are a doula. But your clients will love you because you have a nursing background. So they employ you as a doula, but they're very reassured, and that's why I'm in high demand, of, they're very reassured by your nursing medical knowledge. And if you're a midwife, even more so. Okay, so getting certified is important in this work. It shows your dedication to your career. So if you want to call yourself a professional doula, you should attain some standards of work and be working to a scope of practice that will both protect you and the clients that you will be looking after. Okay. Also, so our scope is physical and emotional healing support, providing information on care options and resources, supporting and assisting the family with infant feeding, educate families about newborn care and characteristics. So this one here, provide information on care options and resources. So this one is, as part of a certification, you will be asked, most associations, to come up with a resource list of doctors, physiotherapists, hospitals, a whole list of doctors. Like, I don't know, I think there are some lactation consultants in Malaysia. I think I checked the register before, but there are not that many. Lactation consultants, so that if they have problems with breastfeeding, they can refer them onto these professionals, okay? Because that's out of our scope of practice. Even on that resource list, it could be a list of cleaners, because when you support someone in their homes, you're not their housekeeper, you're not their nanny, you're their doula. You're supporting their postpartum recovery and their transition into parenthood. Of course, you will do some light household chores that will help the mother, but you are not there to do the, vacuuming the whole house, cleaning the stairs, cleaning the windows and all of that thing. No, it's cheaper for them to hire a cleaner to do that than to hire you as a doula. So I charge $50 an hour right now, and people are happy to pay me $50 an hour. So to pay me $50 an hour to clean their windows, they can find someone cheaper at $25 to do that. So if they're asking you to clean too many things or asking me to clean too many things, I would just say to them, here are a list of cleaning services. So that could be also on your resources. Some other things that we do, educate families on how to maximize age-appropriate sleep for the infant and the family. So having knowledge about infant sleep and how babies sleep, and also teaching parents on how to maximize on their sleep by tag teaming. Not both parents stay up all night trying to look after the baby, but maybe, somebody does the early evening shift from 8 to 12. Another parent does the 12 to 6 shift, and then the next parent does the 6, the early morning shift. So usually if the father has gone back to work, what I say to the mom is, okay, the dad will do the early evening shift. So from 8 till 12 a.m., 8 p.m. to 12 p.m., 12 a.m., sorry, they will look after the baby. Unless the baby's breastfed, you'll bring the baby but all baby care needs will be looked after by dad. And then from 12 to 6, mom will not necessarily up all that time, but mom will look after all the baby care needs so that dad can sleep because he's going to work. And then, at 6 o'clock in the morning, dad takes over for a few hours. Mom can have like 2 hours of good nap, and then he leaves for work at 8 or 9 or 7 or whatever. She can get up and look after the baby, and then maybe they'll have doula help coming in at that point. Provide support to the parents and extended family. So we not only look after the parents, but mom is usually priority, then dad. Oh, sorry, mom, then baby, then dad, then any other siblings. So if they have any other children, and then grandparents. Sometimes we also have to look after them, and then we also look after family pets. It depends, what you choose to look after as a doula. You have a choice because it's your own business. Assist with household chores and sometimes cooking. So I offer cooking. Not everybody wants to offer cooking. So again, that's something that you can decide. And then provide additional resources. So like anything to back up what you're telling them, back up your evidence, like, baby sleep is like this. Then you share with them, an article, hopefully it's evidence-based about, babies don't sleep like adults. This is how babies sleep, for example, okay? Okay, these are the things that we do not do as doulas. We do not diagnose medical conditions. We do not prescribe anything or administer any treatment. Okay, we can remind them to take their medication. We can bring it to them, but we're not administering it. We do not perform any clinical procedures. So in the doula world, a clinical procedure would be taking temperature, baby's temperature or the mom's temperature or something like that. You can get them to do it. You can teach them, tell them, explain to them how to do it. They can do it. And then, you can see what the results are, but you are not to do it yourself. For Kappa, we also do not stay with babies or other children routinely and for an extended period of time, because that is a nanny's job. That is not the job of a doula if the parents are not. Okay.
Also, you
And do
do
not
not
act.
stay with the babies. So your
No,
work,
you stay with if the parents are there in the house, you will stay with them. If the parents go out routinely, let's say they go out like every Tuesday, they have a part-time job, they go like from 8 till 12, then no.
oh, I see. Okay, okay.
Yeah. And do not act as a housekeeper because you're worth much more than that. Okay. So this is how you get your training. You train. So I'm a Kappa trained and certified professional. I provide all these things. Okay. And because I am certified, I meet or exceed high standards, right? So this is just a recap of, what we do as a postpartum doula and within our scope of practice.
Is it a prerequisite that you need to be a nurse?
No,
Not
you don't.
necessarily.
Not necessarily.
Okay.
If you're a nurse, it's a bonus, but it's not necessary. Yeah, you don't have to be a nurse. Anybody, it's not regulated. Anybody can be a doula. Somebody can just walk off the street and say that, they are a doula. Honestly, it's not
But
regulated.
to be a certified, I mean, like,
Yeah, to be certified is different. To be certified, you will enroll on an education platform and you will go through all the steps to certification. So
yeah,
like
but you don't need to have a nursing background, right?
No, you don't. But you have to go through all the steps. You have to pass 2 exams or 3 exams actually. You have to, read 11 books in the reading list. You have to provide your resource list. You have to support 3 families, at least 15 hours of support per family, and you have to get their testimonials on how you supported them. And then you have to write your own evaluations about how you supported those families. Yeah, so it's quite involved, and you get 2 years to gain your certifications once you've done the doula training. The doula training is only 18 seat hours, so it's only 18 hours. So, and then you can go out and you can go and work. But to be certified, there's a lot more steps.
Okay.
So objectives that we covered today, the doula, trained professional providing support in the perinatal period, what a postpartum doula is, support period provided in the first 3 to 6 months postpartum, and the scope of practice. We are not clinicians, nannies, or housekeepers. I hope I
So
covered
you
all.
do provide because our confinement lady usually only for the first month.
Yes.
So this doula can provide service for 3 to 6 months.
Yeah, sometimes even longer. Like for me, some of my families love me so much that it goes even longer, but then you are no longer a doula, right? I've changed to become more like Mary Poppins. But yes, for the first 3 to 6 months is possible. So like, I don't know if you guys have heard of the 4th trimester. So, everyone's pregnant to the 3rd trimester. When the baby is born, that's when your 4th trimester begins. It's the first 3 months of the baby's life. So usually a lot of doulas are involved in that first trimester period. Sorry, the 4th trimester period.
I see. Okay.
Okay.
Yeah.
So here are my contact details. If you want to get in touch with me for anything at all, those are my websites. We just revamped our Thornhill Doulas website. Actually, that is not our logo now. I just didn't change it. I apologize. My Instagram, if you want to follow me, and I would appreciate followers, that's my Instagram, and Thornhill Doulas as well is there. And then if you're interested in Kappa, and Betty is, that's the Kappa website. And I've even given you my phone number. So if you want to WhatsApp me, feel free. I will be home in Malaysia. If you want to meet up, I'll be home in May. So if you want to meet up for a coffee, take my number. Okay, question and answers.
Okay, any questions at all? Any questions? So can you do 2 families at one go for an individual like you?
Yes. So not at the same time, unless they live in the same house. But usually, so in June, I actually have 3 clients in June, but I'm only going to look after 2 of them. So
Oh,
I
no,
can
no,
find-
but can you do like eight morning to 1 o'clock in the afternoon, and then after that 2 o'clock to,
Yes, that's what I'm doing with them. So I'm going to be doing something like 8 or 9, 8:30 to like say 12:30, and then I'll to the other family from,
I see. So you
lunch
can
break.
do,
Yeah,
okay,
break
after
it
your lunch break, then you do another family for
Yeah.
let's say 4 to
Yeah.
5 hours.
Yes, most postpartum doulas here in Canada do a minimum of 4 hours per shift. Okay, so they can have more, but minimum is 4 hours. Some doulas choose to do 3 hours, but I find 3 hours is not quite enough because if they're in the early days of breastfeeding, sometimes 3 hours you don't, you can't catch a feed, right? But if you say 4 hours, you're definitely going to make sure that you're definitely in that 4 hours, surely that baby's going to feed at least once. So yeah, so I can do like a 9 till 1, let's say, and then go to another family, let's say from 3 till 7. Just make your day a long day, and it's only 8 hours work, but then I have to travel from family. That's what I'm doing in June. And then there are some families who love me so much they don't let me go. So I do have a very long-standing existing client that I'm still supporting them today.
Mhm.
And their children are the younger one, which I was looking after as a baby. She's going to be 5 in April, and her brother is 8. So I've looked after the 2 of them for nearly 5 years.
How do you look after these babies then? I mean, like you are
My
juggling
children,
the
yeah.
new families and all.
How do I look after the new babies?
No, how do you juggle these two, like you're going to juggle 2 families sometimes in a day?
Yeah.
How do you
Yes.
look after support this 5-year-old?
Oh, this 5-year-old, so they're very different. They're no longer doula support. Okay, guys.
Okay.
They're more like Mary Poppins, like kind of like after school care. So I usually is in the evening that I help them. When they get back from school at 4, I
Uh-huh.
cook their meal, I help them with their homework, we play, and I kind of like this kind of job because I've seen them progress from baby until they're 5 and watched through their whole development, and also like help the parents, like, I'm not just there, um, just cooking their meals and playing with them. I'm also looking at their milestones, but this is me, okay? This is my own job. This is like, it's not within the scope of a doula, right? Most doulas are just like looking after babies.
Okay, we have some questions here. Hold
Okay.
on. Do you offer lactation advice in your role as a doula?
Yes, you can.
Okay, hold on. You can. And now that you have not had your lactation what yet, right?
I
Uh,
haven't yet, but I am a lactation support provider because I already did 95 hours of lactation specific education, plus a little bit from my midwifery days. But even that, even I'll say that like lightly because like I've had to unlearn a lot of things that I learned during midwifery because like things have moved on. So, there's more research into breastfeeding and stuff that, the stuff that I learned before is no longer relevant.
I see.
So, yeah. And I'm also a lactation consultant intern. So that's why I'm, as a doula, I offer this in my scope. But yes, as a doula, your scope of practice is to offer some advice and knowledge on breastfeeding, but it's mainly basic lactation support. Anything that goes above engorgement and mastitis and inverted nipples and anything like that needs specialist care, you should be, as a doula, be referring to a lactation consultant.
Okay. I wanted to ask you a question. Do you think, or is there any clinical evidence to say that with doula support, there is a reduction in postpartum depression? Sometimes we do not recognize postpartum depression soon enough or well enough and miss it. But do we see less?
Yes, I think if you Google Scholar and Google Scholar with doula support and postpartum depression, you will find a few papers that actually, there is the evidence.
Okay. Cindy Chong asked, can you share with us some challenging experience as a doula that you have experienced before?
Okay, so challenging experiences, usually you know, for me personally, one really sad one was one of my clients. I already helped her with two of her, actually she was one of my first, if not the first, no, one of my first doula clients. And I already helped her with two babies, and she was pregnant with a third, and I couldn't help her with her third baby because I was already booked up by other people. And so I recommended two of my doula colleagues to help her out. But when she was 34 weeks pregnant, she lost the baby.
Oh,
So yeah, so she thought something, they hadn't felt the baby move for quite a few hours, went to the hospital, and they couldn't find a heartbeat. So that's quite challenging as you know, in this profession, even though I wasn't gonna look after them this
but
time.
do you start the doula practice so early? But I'm sure it's not related to the fact that it was whether it was you or whether it
No,
was
it's nothing to do with me, but it's
a
because
doula.
she's
Oh no,
client,
it's not.
right?
Yeah,
Yeah,
but it's also
it
not.
was-
Yeah,
no,
but you were
no,
not
but
there
we
to
do-
support when she lost the baby, you mean?
Yeah, after she lost the baby. So basically, what happens is that when we take on a client,
Hmm?
we will keep in touch with them during their antenatal period. Find out how they're going, how they're progressing, like, you know, seeing the doctor, what did the doctor say, and all that kind of stuff. So that prepares us for, you know, the postpartum period to know, you know, have an idea of what's going to happen. Like if they had gestational diabetes, then, you know, they may run into the, you know, being induced because they're worried the baby might be too big, right? So it's important as a postpartum doula to keep in touch with your clients. You don't just, like, you know, they book me many months in advance because you know, because of my availability, right?
So
Right now, I have clients right until September this year already booked.
okay, when do you start this? When do you start being the doula? Even at the
When they
third trimester?
you start being that postpartum doula when the baby arrives, but before that, you kind of like keep in contact with them. As soon as they sign that contract, it kind of like, you know.
And then when they deliver, you'll be there.
Yeah, when they deliver and they get home, that's when you start supporting them. Or some people want you to help them in hospital. So they deliver, if they have other children and the husband has to go back to look after the other children, then you may be asked to help support them in the hospital. So
Doula?
that's one,
Okay.
that's one very challenging thing if the baby, you know, if the baby dies, okay, because that affects your own like emotional well-being too, as well as the client's well-being and being able to support them through that. Other things would be, I would say, like, you know, when your clients, for me, when the clients treat me like the help, so they think I am, you know, their helper or their maid. I don't like that because they've hired me as their doula and a professional. And when they ask me to do things, that, you know, perhaps I shouldn't be doing, like asking me to scrub out their toilets and stuff like that. That's when I find that really difficult. So in order to overcome those things, what I would do is I would tell them at interview before they hire me that these are the things that I will not do. Okay, don't expect me to do it and don't ask me to do it. But you know, it's just something that, you know, can't be helped. Sometimes they just think that they're paying you money, so you are there, the employee, to do whatever they need you to do, which may be out of the
Not
scope.
all doulas will cook, is it?
Not all will cook. Some don't know how to cook even, like here. Or like you, Betty. I know you
I
always
will
say
never be a doula.
actually,
Sorry.
you
I
can
cannot
cook,
be a
but
doula.
you know,
I don't know how I will never be a I don't think I'm capable of that to support the child or the mom.
yeah, but you love babies, right? It will be ideal for you.
No. I love to play with babies. There's two different things. I love to make babies cry and love to play with them, but I do not want to look after them. No. No.
So, does that answer your question? I guess another challenging
that's
thing is like, because you're a nurse already and you're there as a doula with a different scope of practice. When you're there, you want to be more clinical than, you know, you need to be, and that can be a little bit difficult, a little bit challenging.
I understand, because you think that you can't separate your previous profession as a nurse and you being a doula.
Yes. Yeah. you will have to take off your hat. So you wear lots of different hats. You can say to them at that point in time, say, okay, I'm going to take off my doula hat. Now I'm advising you as a nurse, and you really need to act on this. Something like that.
Okay, I think we will
Okay.
stop here. Thank you
Thank
very
you, guys.